Hi, my name is Magdalena Cerda. I'm a professor at NYU Langone Health, and I'm here to talk about this upcoming study. This study was really motivated by the fact that we're in the midst of an overdose crisis where more people die of an overdose every single day. And so we believe that we can use simulation models to help local jurisdictions figure out what they need to invest in order to reduce overdose deaths. In this particular study, we wanted to find out how much would delivery of medication to treat opioid use disorder and naloxone have to increase in each county in order to reduce overdose death by 40% in 1 year. We focused on 8 counties in New York State that were part of the NIDA-funded Healing Community Study. We hypothesized that the scale-up needed would really depend on pre-existing levels of treatment access as well as county urbanicity. Because of that, we stratified our analysis by both baseline treatment receipt and urbanicity in each county. In order to do our study, we carried out an agent-based model where agents transitioned between different forms of opioid use disorder, medication to treat opioid use disorder, naloxone, and overdose. We found that results really did depend on pre-existing levels of treatment access and urbanicity. For example, in this county, which was urban and had high baseline treatment access, one would need to increase initiation into medication to treat opioid use disorder by 150% and increase naloxone distribution by 200% in order to reduce overdose deaths by 40% in 1 year. In contrast, in this other county, which was rural and had low pre-existing levels of treatment access, one would need to increase treatment by 300% and naloxone by 1,000% to achieve the same outcome. Of course, as with any kind of simulation model, we had to make a number of simplifying assumptions, including these listed here. Because of that, I would say that these findings should be interpreted as qualitative rather than quantitative insights. In conclusion, we found that counties required a unique combination of treatment and naloxone delivery in order to achieve the 40% overdose reduction target. Further, we found that neither of these interventions were able to achieve the target alone. This really highlights the need for a combined approach in order to achieve a sizable reduction in overdose deaths. But further than that, we also found that even if naloxone and treatment were implemented in combination, one would need sizable shifts in investment in both in order to achieve the target, which really calls for a whole-of-system approach to overdose prevention. Thank you so much for listening.